The University of Otago Wellington is part of the Division of Health Science, and it's quite a large school, so we have 9 departments that cross a number of specialities. We have over 60 PhD students on our campus and offer a number of postgraduate courses, postgraduate diploma and certificate and master's level as well. Our research students come from a range of different backgrounds. We have a lot of people from health professional backgrounds, so we have physicians and medical students. We have nurses and allied health professionals doing PhDs with us, but we also attract a lot of social science students who might be doing work in public health or primary care and GP practice, or they might be doing work in medical areas. And we also have some students who come from basic science background who might end up working in surgery and anaesthesia or child's health or other areas like that.
My name is Philip and I'm doing a PhD in human physiology. And what we're looking at in particular is the regulation of blood flow to the brain. So what things influence how stable and continuous the blood going to your brain is. The brain's very sensitive to even a temporary disruption in blood flow. So we really need to understand what factors drive it, and then in a disease state, how can we manage those factors to make sure your patient's got continuous, smooth blood flow to their brain. Wellington in particular is very strong with its health research, both biomedical research that I'm doing, as well as other disciplines like public health.
So I'm looking at risk factors for strep throat, and strep throat is quite important because in some children it can go on to cause rheumatic fever. Rheumatic fever is a really horrible autoimmune disease where the immune system can attack the heart valves and cause quite significant damage. So if we can identify the children who are more likely to get strep throat and then go on to develop rheumatic fever, then hopefully we can just get in there before the strep throat even happens. My supervisors are really good at letting me know of other similar research projects going on overseas, and just from reviewing the literature I can see how my research would fit in, so that's really good at giving me some perspective and also thinking about where I might like to work or what I'd like to do after I finish my PhD. Up in Wellington it's great because it's quite a small campus, so there's not too many other people around, but there's lots of resources and there's also lots of support staff, so if you run into an issue there's always someone around who can help you out, or maybe quite a few people. Also, I really like living in Wellington because my parents are here and my friends from high school and some new ones as well, so it just makes for a really good lifestyle up here.
My PhD is about people who come to emergency departments with intentional self-harm, but they also present for another reason within a short time frame. And what I'd like to know is, is this group at higher risk of dying or serious self-harm compared to people who just present with self-harm? For me, it's very handy being next to the hospital because I still work in the emergency department. I noticed that I've changed as a nurse. I used to be a nurse, I come to work, I go home. But now I'm much more questioning and wanting change in emergency departments and knowing how to go about it by saying, okay, so what about we do some training in mental health and getting other services involved. I am much more in a position of making it better for people.
For a number of people, life takes them north of Dunedin for a whole range of reasons, family and relationships and so forth. If people are wanting to continue with their academic career and they're wanting to develop a research qualification arm to that academic career and they are coming north, then Wellington's certainly a good place to look for research experiences.